All right, Matt, we're just getting started in your knee. We've already harvested your hamstrings. I made those 2 incisions. Here is your PCL. So your posterior cruciate ligament is sitting right there. This is where your ACL should insert on the tibia, and this is where your ACL should originate up on the femur. We're going to use a valgus force to enter here into your medial compartment, and you did have a little bit of a recurrent tear that I did not feel was going to heal here on this medial side, so I clipped out the medial meniscus, and you can kind of see where the remnant was, but through the mid-body and the anterior horn, it looks completely normal. When I come into the lateral compartment, the lateral I figured was the worst tear and was more concerned about it, but as we take your knee into a figure of 4 position, you can see where those previous stitches are, but you can see that the majority of that lateral meniscus is healed and scarred in. We had a bad radial tear involving both the white-white as well as the red-white, and even the red-red zone went all the way back to the popliteus, which is that tendon there in the middle of the screen, where we put those side-to-side stitches, and for the most part, that's scarred in. The majority of that is not normal meniscal tissue. It's just scar tissue, and that's why it's so thick, but we're going to give it the benefit of the doubt in terms of healing. We're then going to take your leg into extension. I'm going to come into the suprapatellar pouch. Here's the undersurface of your quadriceps tendon that I am pushing on. And then as I pull the camera back, you'll see your patella at the top of the screen, and the trochlea is here at the bottom of the screen. And we know from your MRI that you had a little bit of injury to that medial retinaculum, but just like the first surgery, your patella track's very nice. Now, this is some scar tissue that I'm going to clean up. That's around your patella and kind of around your patellar tendon, right there in the middle of the screen that will debride with a shaver. I'm going to come into the medial gutter now. So the thigh bone is on the left, the skin is on the right. That looks completely normal. I'm pushing on the outside of your skin, causing that to indent, no loose bodies. And then I'm going to come across the knee into the lateral gutter. There's a little bit of some chondral debris that is most likely from the notchplasty. But then as I bend your knee back, there is the popliteus tendon right there in the middle of the screen. So I'm going to clean up the scar tissue around your patella. The cartilage looks good throughout the entire knee, and then once we clean up the scar tissue, we'll start drilling your tunnels. So now I've passed a guide pin into the center of your ACL footprint on the tibia. That's that metal structure right in the middle, and then we're going to come over the top of that with an 8mm rigid reamer, because that's how big your hamstrings were. So see a whole bunch of bubbles and debris. So now there is a green suture going in through the femoral tunnel. So there's a socket, there's a smaller tunnel at the end, and then a bigger tunnel that measures 8mm. You have about 1.5 millimeters to 2 millimeters of a back wall. And we are now going to pull the graft up into the femoral tunnel. So you're going to see this green suture pull a green and white suture up and through. And then behind that, you're going to see a little copper button. And that's what we're going to pass onto the cortex of the lateral femoral condyle. So we're pulling. This copper button is going to pop in through there. And that's what we're going to use to deploy it on the other side. So we're going to keep pulling on the white, and there is your hamstring graft. So that white collagen tissue is your hamstring graft that we're pulling up into the femur, and we'll get that secured. All right, so now here's your new ACL graft. So I fixed it on the femoral side with that little button, and I fixed it down here on the tibial side with a screw and a plastic screw. So I'll clean up those little frayed edges right there. But the bulk of the graft is nice and intact, and it's very tight. No evidence of any notch impingement, no PCL impingement. We'll get you to the recovery room. Good job.